We've been receiving a lot of questions related to COVID-19, especially as the state begins to gradually reopen. So we asked you to send in your questions for Governor Chris Sununu, and he is joining us live on set.
We are all practicing social distancing, so is the governor, and I will start with the first questions. Welcome, Governor. Good to see you today.
Good to see you.
So Kate wants to know, will you extend the stay-at-home orders? I think it's in everyone's best interest. We will see large spikes if this is not done.
So we moved to, great question, we moved to stay-at-home 2.0. That just allows us to start taking some very simple steps with some businesses, allowing retail and some outdoor seating and restaurants, things of that nature. But yes, we anticipate the stay-at-home order to be in effect, at least in the short term and maybe even in the long term. We just don't know. We're very data-driven in what we do. We look at not just the data trends and spots and how it affects our ability to manage the healthcare system. All those variables come into play. But right now we are in what we call stay-at-home 2.0, and we see ourselves being there in some form, at least in the coming weeks and maybe even months. We're just not sure.
Jennifer asks, do you think that rushing to reopen for the economy's sake will spread the virus to cities and towns that haven't been plagued with COVID-19 yet?
Potentially, absolutely. Rushing to reopen anything creates a lot of risk, which is why we're not rushing. We are really taking some very, very simple steps, allowing 50% capacity in retail stores, outdoor seating with good physical distancing at some restaurants that can do it around the state, starting this coming Monday. And then we'll watch the data as it moves forward. There's other pieces out there, but again, Public Health, the Department of Public Health has really reviewed all the different guidance documents that we have. They make sure that whatever we're doing is sound, it's safe, it's manageable, and we'll really continue to watch the data to make sure that as we take these very simple steps forward, we're doing it in a way that always keeps public health paramount in mind.
All right, Tamara wants to know, when will we get guidance on summer camps? Day camps and sleepover camps are different. Parents will need to plan with more businesses opening. If there's no childcare, many individuals will not be able to return to work.
So yeah, there's kind of three questions in there if I can. So we did a huge amount of money, $25 million into a variety of different opportunities of childcare, separate from the camps today. And that's going to be done in conjunction with the Department of Public Health, Health and Human Services. They provided a great plan, and we're very excited to get that moving forward. Summer camps, overnight camps, very different than day camps. Day camps they're both very important from a childcare perspective, but they both have very different variables in that a summer camp is overnight. All the kids are together, but they're sleeping in the same cabin. There's more clustering. You can potentially do testing to bring them in. The day camps you see at the YMCAs or the Boys and Girls Club, a little easier to manage in terms of the kids, but then again the kids are going back and forth in and out of the community, so there's another risk there. So Dr. Chan and myself were actually talking about this just last night, looking at pathways for both of those. We're not at a position where we can make any announcements yet, probably not for a few more weeks in both of those areas. Looking at some other guidance in other states, seeing how it's being done. We want to give people as much time as possible to prepare. We appreciate that, but we're just not ready yet. We don't want to rush anything and do it wrong. It's better if we have to take a couple extra weeks to get it right, it can make all the difference.